Hello everyone! You know that feeling, right? That queasiness in your stomach, the sudden urge to throw up? Today we're diving into a common but often misunderstood issue: nausea. Nausea is a sensation that makes a person feel they need to vomit. Sometimes individuals with nausea do vomit, but not always. In this video, we explore what triggers nausea, including a list of 9 common causes. We will also discuss some of these conditions in more detail and describe their symptoms and treatments. From common culprits like food poisoning to more complex conditions, we'll break down everything you need to know about nausea. Watch till the end to find out what symptoms children need to look out for. Let's start with those moments when you feel like you've eaten something that disagreed with you. Big time. Food poisoning, often caused by bacteria like Salmonella or E. coli, can hit you hard and fast. You're likely familiar with the symptoms: stomach cramps that feel like a wrestling match is going on inside you, vomiting that seems to erupt out of nowhere, and diarrhea that has you running to the bathroom more times than you can count. The stomach flu, on the other hand, is caused by a virus, and while it shares some symptoms with food poisoning, it can also come with fever, chills, and body aches, making you feel like you've been hit by a truck. The key difference? Food poisoning usually resolves quicker, often within a day or two, while the stomach flu can linger for a week or more. Now let's talk about those nasty viruses that seem to make their rounds every year: the flu and COVID-19. You know the usual suspects: fever, cough, sore throat, and fatigue. But did you know that nausea and vomiting can also be red flags for these viral infections? While not everyone experiences these symptoms, they can be more common in cases of COVID-19. It's like your body's way of trying to fight off the virus, even if it means sacrificing your last meal. So, if you're experiencing those telltale flu-like symptoms along with nausea, it's always best to err on the side of caution and get tested. Sometimes nausea is your body's way of telling you that something's not quite right in your digestive system. Think of it like your gut sending you an SOS signal. Conditions like gastritis, where the lining of your stomach becomes inflamed, can cause nausea, especially after eating. Then there's gastroparesis, a condition that slows down the emptying of your stomach, leading to that feeling of being uncomfortably full and nauseous. GERD, or gastroesophageal reflux disease, can also be a culprit, with stomach acid backing up into your esophagus and triggering nausea. And let's not forget about irritable bowel syndrome, IBS, a common disorder that affects the large intestine and can manifest as nausea, abdominal pain, bloating, and changes in bowel habits. Celiac disease, an autoimmune disorder triggered by gluten, can also cause a whole host of digestive issues, including nausea. And if your gallbladder or pancreas aren't functioning properly, nausea can be a sign that something's amiss. We often think of nausea as a purely physical symptom, but the truth is, our mental and emotional well-being can also play a significant role. Ever noticed how your stomach churns with anxiety before a big presentation, or how stress can make you lose your appetite? That's the mind-gut connection in action. Stress, anxiety, and other mental health conditions can disrupt the delicate balance of our digestive system, leading to symptoms like nausea, indigestion, and even changes in bowel habits. It's like our gut is a second brain, reacting to our emotions and thoughts. So if you're experiencing persistent nausea, it's essential to consider both physical and mental health factors. Our inner ears are responsible for more than just hearing. They play a crucial role in our sense of balance and spatial orientation. When something disrupts the delicate mechanisms of the inner ear, it can send our world spinning, literally. Motion sickness, a common culprit, occurs when our brain receives conflicting signals from our eyes, ears, and body about our motion. It's like our senses are having a disagreement, and our stomach bears the brunt of it. Labyrinthitis, an inflammation of the inner ear, can also cause vertigo, that dizzying sensation that makes you feel like the room is spinning. And then there's vestibular neuritis, another inner ear condition that affects balance and can lead to nausea and vomiting. These conditions can be triggered by viral infections, head injuries, or even certain medications. For many women, pregnancy is an exciting time filled with anticipation, but it can also be a time of hormonal roller coasters and physical changes. One of the most common and often dreaded symptoms of early pregnancy is morning sickness, a misnomer because it can strike at any time of day or night. while the exact cause of morning sickness is still not fully understood. It's thought to be triggered by hormonal fluctuations, particularly the surge in human chorionic gonadotropin, HCG, the hormone that confirms pregnancy. The good news is that for most women, morning sickness subsides after the first trimester. However, some women may experience more severe forms of nausea and vomiting during pregnancy, such as hyperemesis gravidarum, which can lead to dehydration and require medical attention. Our thyroid, a small butterfly-shaped gland in our neck, plays a mighty role in regulating our metabolism. When this tiny gland goes haywire, it can wreak havoc on our bodies, and nausea is often a telltale sign. Hyperthyroidism, an overactive thyroid, can send our metabolism into overdrive, causing symptoms like rapid heartbeat, weight loss, anxiety, and yes, you guessed it, nausea. On the flip side, hypothyroidism, an underactive thyroid, can slow down our metabolism, leading to fatigue, weight gain, constipation, and again, nausea. So, if you're experiencing persistent nausea, along with other symptoms that suggest thyroid dysfunction, it's crucial to get your thyroid levels checked. Our nervous system is like the body's intricate wiring system, transmitting signals between the brain and the rest of the body. When this complex network is disrupted, it can lead to a wide range of neurological conditions, some of which can manifest as nausea. Migraines, for instance, are often characterized by intense, throbbing headaches, but they can also be accompanied by nausea, vomiting, and sensitivity to light and sound. These debilitating headaches are thought to be caused by abnormal brain activity that affects blood flow and nerve signals. Other neurological conditions, such as meningitis, encephalitis, and brain tumors, can also cause nausea and vomiting, often as a result of increased pressure within the skull. Medications are designed to help us feel better, but sometimes they can come with unwanted side effects, and nausea is a common culprit. From over-the-counter pain relievers to prescription antibiotics, many medications list nausea as a potential side effect. This is because some medications can irritate the stomach lining, while others can affect the brain centers that control nausea and vomiting. If you're experiencing nausea after starting a new medication, don't just grin and bear it. Talk to your doctor or pharmacist. They may be able to adjust your dosage or switch you to a different medication with fewer side effects. Dealing with nausea can be incredibly uncomfortable, but there are several things you can do at home to ease your symptoms. The NHS recommends staying hydrated by sipping on clear fluids like water, diluted juice, or oral rehydration solutions, especially if you've been vomiting. Eating bland foods like crackers, toast, or rice can also help settle your stomach. Avoid greasy, spicy, or acidic foods that can further irritate your digestive system. Getting some fresh air and practicing relaxation techniques like deep breathing or meditation can also help alleviate nausea. And if you're struggling to keep food down, try eating smaller, more frequent meals throughout the day. While most cases of nausea are temporary and resolve on their own or with home care, there are times when it's crucial to seek medical attention. If your nausea is severe, persistent, or accompanied by other concerning symptoms like chest pain, shortness of breath, confusion, stiff neck, high fever, or bloody vomit or stool, don't hesitate to call 911 or head to the nearest emergency room. These could be signs of a more serious medical condition that requires immediate attention. Let's tackle some frequently asked questions about nausea. What are some quick remedies for nausea? Ginger, peppermint, and acupressure wristbands have been known to help some people find relief from nausea. What about over-the-counter medications? Bismuth subsalicylate, Pepto-Bismol, and antihistamines like dimenhydrinate, Dramamine, can be effective for nausea and vomiting. But it's always best to consult with your doctor or pharmacist before taking any medications, especially if you have underlying health conditions or are taking other medications. When should I be concerned about nausea in children? Children are especially vulnerable to dehydration from vomiting and diarrhea, so it's essential to seek medical attention if their nausea is accompanied by fever, feeling lethargic, or signs of dehydration. That was a lot of information about nausea, but I hope you found it helpful. Remember, nausea is a common symptom with a wide range of causes, from the benign to the more serious. By understanding the potential triggers and symptoms, You can take steps to manage nausea effectively and seek medical attention when necessary. If you're experiencing persistent or severe nausea, don't hesitate to consult a healthcare professional for proper diagnosis and treatment. Please like, comment, and subscribe for more content. Thanks for watching, and stay healthy.